Hello there. Thanks to everybody for watching this. Since the onset of the pandemic, we've been seeing increased disparities in various health conditions, mental and physical, and some groups are being disproportionately affected by this COVID-19 pandemic. So today I want to talk about the health disparities we're seeing in rural communities because of COVID-19. And before we get started talking about that, I want to introduce myself. I'm Nicole Charlot. I'm an intern with the Research to Policy Collaboration, and I am here with Dr. Dara Whalen. Dr. Whalen, would you mind briefly telling us about your research area?
Hi, yes, I'm an assistant professor at the College of New Jersey. I'm also a nurse practitioner. My area of study and my area of research is on sexual violence, trauma, and specifically in underserved and marginalized populations.
Wonderful. Again, thank you so much for being here today. We're really excited to talk with you about this. So to get right into it, would you mind telling us about some of the health disparities that we are seeing due to COVID-19 in rural communities?
So the health disparities we're seeing specifically related to COVID-19 are not that different from the health disparities that already exist in those populations. There's a disproportionately higher risk of serious illness or death from COVID-19 in those populations because of those pre-existing conditions that are already related to health disparities, obesity, diabetes, hypertension. So in those populations where healthcare access is difficult, they're being disproportionately affected by the consequences of the infection. One of the things that's different in the rural populations that we're seeing right now is that the urban populations were where we saw the seeding of the virus go quickly, and at the start of this pandemic, that's where we saw it. What's happening now is that we're seeing a decrease in cases in the urban populations, and it's moved into the rural populations. What can happen in rural populations, because they tend to be very community specific and community oriented, is that now that it's jumped into that community, it's spreading rapidly. Part of that has to do with how they live their lives. In rural settings, there tends to be small gathering spaces or places where people visit frequently, small rural stores and things like that. And in some communities, there's just one store. So we're seeing that spread of the virus because the individuals in those communities don't really have any options. They're very minimal. So not being able to connect as well as get what you need puts you at higher risk in that small environment. Access to affordable health care is also an issue and is also a reason why people have difficulty once they get infected getting access to care because of the distance between where they live and where care lives as well can be difficult. In Native populations, it can be the nearest clinic can be 100 miles. And the nearest access to a hospital could be 200 to 300 miles. So having a lack of access allows these conditions to get people to get sicker with these pre-existing conditions, and then put on when you add to the fact that the local hospital have a small amount of ICU beds or no ICU beds at all, compounds the devastation that occurs in these populations. We also see coexisting conditions, mental health disorders, substance abuse disorders, and other types of disorders that can come from difficulty in self-care that impact the recognition of illness as well as the ability to access care once you're feeling ill. In some of the other rural populations, family spread is an issue. People live in one house that may have poor ventilation. that has no running water. The access to potable water is difficult. The traditional way of living is kind of cramped together, and everybody does everything, everybody touches everything, and that's the way that they exist. So that increases the spread of the virus, which again puts them at higher risk than other places where there is more access to clean water and to spread out spaces. The places where we see community spread can typically be in industrial settings. Meatpacking plants are typically in rural populations. And the people that work in meatpacking plants typically have a lower economic status, they have less access to health care and those types of things. And they have no choice but to go to work even if they're not feeling well. And when everybody's close together, it's really very difficult to maintain and contain that virus. The top reasons for health disparities, again, are pretty consistent with what they are even without the COVID-19 virus. Higher rates of uninsured, access to care, as I said before. Lack of primary care is a huge issue. When you have a provider that you trust and a provider that knows you, then you're more likely to reach out when you're not feeling well. Rural hospitals have been closing, so access to hospitals once you start feeling ill has been difficult for people in rural communities. The infrastructure related to telehealth can be lacking in these rural communities. Some areas of the country do a really good job of that. Alaska, for one, has a pretty robust telehealth infrastructure, and they've been providing mental health services for years now using telehealth. So that's something they invested in as a state and has been helpful. People in poverty, people with low educational opportunities, people who have lack of social support, those people are at higher risk for anything that comes around and compounds with their pre-existing condition. So when we talk about what we can do to make a difference, when we're talking about the health disparities related to COVID-19, so primary care is a huge issue. We have a decreasing number of primary care providers in this country, and primary care providers find it difficult to sustain practices in rural areas. So we need to be more innovative about how care is provided. We should support education for healthcare providers who want to practice in rural settings. We should look at healthcare structure and regulations. We've allowed telemedicine and telehealth to boom during this period of time. It's allowed for greater access to care, not just in the context of COVID, but in the context of continuing chronic care management. The regulations have been relaxed. We're studying what the impact is, and we should be cognizant of how, when this pandemic seems to ebb at some point, not going backwards. The relaxation of regulations as far as in between states and in between organizations has helped to increase access to care as well. And we need to look at the data and the outcomes that come from that to be able to support or to see if we should continue looking at those regulations that actually stifle access. Over the last 60-odd years, even longer, the focus has been less on health promotion and disease prevention. And we also, our public health workforce has decreased over time. And we're seeing a huge need for skilled public health workforce, as well as researchers and clinicians who have an understanding of population health that has come to the forefront with what we're seeing here in the COVID pandemic. So some of the things that we should look to do is to restore and expand public health infrastructure, support public health programs in colleges and universities, and place adequate value on the jobs that and the professions that come out of those programs. Make sure that we're integrating population health into all our healthcare professions, an understanding of how disease can spread and what puts people at risk, especially in populations where there's access to care is a huge issue. Looking at health promotion, we know that in rural populations, the obesity, diabetes, hypertension, as I spoke to before, those are risk factors for people in rural populations. And with adequate health promotion, disease prevention, and the ability to actually get paid for those types of visits are something we should consider as a way to decrease those risk factors that can actually be compounded when people are exposed to this virus. Both investigating and addressing the risk factors is something that we should consider. Data collection and analysis, we want to make sure that we're making tools and databases user-friendly, understandable, and be able to communicate to the general public. And in rural communities, it's really important that the communities themselves are involved in the development of those types of processes, as well as how to communicate and how it works for them. Lots of communities have their own way of going forward and communicating, and we need to become more skilled at utilizing systems that are already in place and supporting them as the communities themselves have developed them. There needs to be an investment in nurse practitioners can be primary care providers as well, and some of the regulations restricting the ability to practice autonomously have been reviewed and released during this pandemic, and it's increased the workforce that's able to take care of patients. So we need to take a look at that data, what the outcomes look like, and consider the continuing that type of ability to practice at their peak level. We want to shore up communication, be able to partner with those rural communities in looking at the things that need to be evaluated as well as revised in their day-to-day living. They're not the same as people who live in big cities, but they have similar circumstances and obviously similar needs.
You did a real good job of summarizing all of that. That's really, really valuable information. What's the best way to really understand what these individual rural groups really need? I imagine it's a little bit easier on state, local levels, but also at the federal level.
So I think what they need is to have a voice, to be a bigger partners in the conversation. There are, especially in Native populations, the resources can be an issue. So partnering with the tribal organizations to make sure there's a proper allocation of funding that allows them to work with their partners in research and in healthcare to create these creative solutions to their unique problems. We know as researchers that research takes time, but research doesn't have to take too much time all the time. And we need to be using those data sets, those pieces of information that are telling us maybe not the exact path we have to go down, but at least the road that we might want to consider. And looking at the research, collecting data in a way that is meant not just to know and not just to learn about that population. It's to help, and it's to create a better way of or a healthier way of living, incorporating what they already know about their generational information.
To go back to another point you made earlier, it sounds like one of the reasons we're seeing these disparities in rural populations is because of the jobs that they're working. And so I'm wondering if there's any policy level things that can be done to help those kinds of problems in the work environment.
I think there needs to be some policy involvement, minimal allowance of space or maximum allowance of space, and making that, looking at shift working in a different way, looking at PPE. In those meatpacking plants, your exposure is as high as if you were in an intensive care unit. There has to be a rethinking of how the workplace looks and what's considered healthy for those workers. I think they need more guidance, they need more information, and they need more help with supporting a cleaner environment, a safer environment. And that's where we should be looking at ways to protect workers in all areas in this country. Other places where we've seen the virus spread in rural populations are nursing homes. And the people who typically work in nursing homes are people who are who need these jobs, who may not have a higher level of education. You know, there's a level of skill that's required for that job, but the pay is kind of on the low end. And these are people who are working hard and putting themselves at risk to take care of those people that need their help so desperately. At the policy level, we need to re-look at access to care, fair wages, and things like support during crises that is timely and adequate for people to be able to go, to be able to do the jobs they need to do to help both prevent these types of things from happening as well as dealing with them at the front line.
I think that makes a lot of sense. And you touched on some good examples of supports like childcare, fair wages. I'm wondering if you could give any other examples of, you know, concrete supports that we could be giving to particularly rural communities at this time.
Okay. So one of the things that's lacking in rural communities is access to education at a level that's sufficient to be able to skill build. So there are going to be places where jobs are going to not exist any longer. So what do they do now? So we need to invest in job reallocation and job training, as well as higher levels of education in.
Oh, I think that makes a lot of sense. I know you talked about telehealth, and I understand that in a lot of rural communities, access to internet is sometimes an issue. So I'm wondering if you could kind of tie together like telehealth, internet access, all of those things, in addition to education, and how that can maybe address some of the disparities we're seeing as well.
So some of the steps to get access to that is to work with local governments and regional governments and healthcare organizations, along with your local providers, to support that expansion of access to data and to information, and which will link to health information as well as access to care. They need to be equitable, though. The collaboration doesn't need to be so heavily on one side. Looking at ways to communicate that makes sense to the communities themselves. And it doesn't necessarily all have to be high tech. In the rural communities that I worked in Alaska, a CB radio still existed, and it still does today. And announcements are given out over the CB radio, because that's how people listen to the news, and that's how people access information. But they also have high-speed internet, and they have a infrastructure that's really, really robust, because they invested in that state to have that happen. Kids that are out of school in rural communities who don't have access to internet or don't have access to their own laptop need to be supported. That school system needs to be supported in making sure they have that. Those providers need to be supporting that system together with their community. So we don't have to have everybody have a smartphone. We don't have to have everybody have, high-speed internet, but we have to have some hubs. We have to have some community resources. And what it does is it creates jobs, it creates relationships, and it allows for community members to have the skill and the ability to take care of their own community members with help as they need it.
I think that makes a lot of sense, but I'm wondering at more of the federal level, like bigger picture, what can be done at those higher levels in order to have more trickle-down effects that help more individual, smaller communities?
Right. So a couple of the things I talked about earlier as far as releasing restrictions on collaborating. So having as a nurse practitioner, if I went from this state to a state 3 states over, it's a whole different can of worms. There's different regulations. Scope of practice is different, even though I'm certified in the same way as someone else, and I'm also educated in the way as someone else in a different state. There's and barriers and impediments into my being able to care for patients at my full scope. That was changed in the VA system recently. So nurse practitioners all throughout the VA system, regardless of what state they're in, can practice at their full authority. Telemedicine, telehealth, same thing. There are layers of regulations in the way, some at the state level and some at the federal level. We need to look at those regulations. Increasing support for different types of job training can be done also at the federal level. There's a lot of history. There's a lot of generational trauma that's occurred that needs to be addressed and needs to be looked at. It adds to stress. And stress adds to these chronic conditions that we know about. So looking at trauma, looking at how isolation, sadness, lack of access to care, lack of access to affordable housing, jobs, and having a meaningful life, all of those things add to our physical well-being, and if those things are interfered with and our levels of stress are continuous over time, then it puts us at higher risk for things like obesity, hypertension, diabetes, which puts us at risk for dire consequences when we're talking about COVID-19.
Yeah, no, I think you've done a really good job in highlighting just how interconnected all of these things are, and you can't just address healthcare without also touching on education and intergenerational trauma. Like, it all really comes together, and I'm really glad that you've brought all of that up. I think we've covered a lot of ground, but I just wanted to ask if you have any final thoughts, anything that we didn't talk about that you really wanted to emphasize.
Just from the beginning when I started to speak, we already know these risks and the factors that create health disparities. We know they exist. We are seeing that those risk factors, those that cause health disparities, are translated to risk related to COVID-19. So it's being reinforced that we have to do a better job at mitigating those risk factors that add to health disparities. It's reflecting in every population. There are some unique experiences and unique problems in rural communities that can be addressed, again, working with those communities, understanding those communities, and in very innovative and different layers of ways.
I think that makes a lot of sense, and now it's time to get to work. Again, I just really want to thank you so much for being here today. You've really illuminated a lot of stuff. I'm really excited about all of it. So yeah, thanks so much for being here.
Thank you so much. I appreciate the opportunity.